Hello everyone. Today's topic is subclavian artery, internal jugular vein, cervical sympathetic chain. So you already know subclavian arteries. They are so called because they are located beneath the clavicle. They are main source of blood supply to upper limb. Hence they are known as artery of the upper limb. They also supply blood supply to the thoracic wall, head, neck and brain through its branches. We will see how. So you can see here on right side there is brachiocephalic trunk. From there is right subclavian artery and right common carotid artery. On left side there are separate arteries, subclavian artery and left common carotid artery, and this is arteriogram image. You can see the brachiocephalic trunk, you can see right subclavian, you can see right common carotid artery. Okay, you can see here the vertebral artery also. Now, origin. So right subclavian artery arises from the brachiocephalic trunk, which is, and here where exactly? Behind the sternoclavicular joint at the root of the neck. Here there is a sternoclavicular joint. So behind that it is originating, and it has only the cervical part. Okay, left subclavian artery arises from the arch of aorta. You can see here it is arising from the arch of aorta, runs upwards on the left mediastinal pleura, and it is making groove on the left lung, and it enters the neck by passing behind the left sternoclavicular joint. Okay, so it has thoracic as well as cervical part. You can see here this is the brachiocephalic trunk. That is why the subclavian artery has only cervical part, but here the left subclavian artery is arising from arch of aorta. That is why it has thoracic and it has cervical part. Cervical part extending from the sternoclavicular joint to the outer border of the first rib, and beyond the first rib the subclavian artery continue as axillary artery on both the sides. Now what is the course? You can see the both arteries pursue similar course. On each side you can see the subclavian arteries is arching laterally across the anterior surface of cervical pleura, and then they are reaching here onto the first rib here. Can you see? This is the first rib, this is the clavicle. Lies posterior to scalenus anterior muscle. Can you see this muscle? This is scalenus anterior. At the outer border of the first rib, I have already mentioned, that is continuing as axillary artery. And what is the termination? At the outer border of the first rib, the subclavian artery continue as axillary artery. Now what are the parts? I have already mentioned there is the muscle that is known as scalenus anterior. So because of this scalenus anterior, it is divided into three parts: first part, second part and third part. First part is from the origin to the medial border of scalenus anterior. From origin to the medial border of scalenus anterior. Second part is lying behind the scalenus anterior, and third part from the lateral border of scalenus anterior to the outer border of the first rib. Now what are the relation? You can see so many relation are there. First part has, there is a relation, there is something known as common carotid artery, internal jugular vein, vagus nerve, vertebral vein, phrenic. All these relation you can go through. Then here you can see second part. So obviously one structure you know in the second part which is anterior to that, and that is the scalenus anterior muscle. Okay, so you can see here the scalenus anterior muscle, and there is phrenic nerve on right side only. Okay, and then there is sternocleidomastoid. So these are the relation. Third part, so here you can see there are suprascapular, transverse cervical vessels, subclavian and external jugular veins. All these are related here to the third part of the subclavian artery. Now what are the branches? So you can see, you can remember branches of the first part, second part and third part. You first see the right side. So right side you can see V, I and T, C and D, that is vitamin C and D. So right side there is vertebral artery, internal thoracic artery and thyrocervical trunk, and second part there is costocervical trunk, and third part has dorsal scapular artery. Now what happens on left side? On left side the subclavian artery does not give any branch from the second part, because on left side the first part itself gives the costocervical trunk. Okay, dorsal scapular artery is occasional branch that may arise from third part of the subclavian artery. When it present, it will replace the deep branch of transverse cervical artery. Now, what is vertebral artery? So here you can see the vertebral artery. This is the principal arteries which supply the brain. It is the first and largest branch of subclavian artery. What is the origin, course, termination? It is arising from the upper aspect of the first part. You can see here, and it is running vertical upwards to enter the foramen transversarium of the transverse process of C6 vertebra. Then it will be passing through the foramen transversaria of the remaining cervical vertebrae, okay, and then it is emerging out through the foramen transversaria of the first cervical vertebra. It will come around that, it is winding around the lateral mass of the atlas. Here is the lateral mass, and it is passing through the foramen magnum and reaching the cranial cavity. In cranial cavity, it is uniting with the vertebral artery of the opposite side at lower border of the pons to form the basilar artery. So you can see the vertebral artery has four parts. First part, second part. Here is the third part which is present in the, here you can see that in the suboccipital triangle, and there is the fourth part which is present in the foramen magnum. Okay, so first part from the origin to the foramen transversaria of C6. Okay, and this is lying in the splenovertebral triangle. Can you see here? This is the splenovertebral triangle within which there is this artery is lying. Splenovertebral triangle, you can see laterally it is bound by the medial border of scalenus anterior muscle, medially by the vertebral bodies of C6 to T2, and here if you see the base is by either you can say the subclavian artery or you can say the bone, that is clavicle. Here second part, as I have told you, in the foramen transversaria of C6 to C1. Third part is also known as suboccipital part, which is from the foramen after coming out from foramen transversaria of C1, and it is till it is reaching the foramen magnum. Okay, this is lying here in the suboccipital triangle, and fourth part is intracranial part, which is lying within the foramen magnum. Okay, it is joining with the vertebral artery of opposite side to form the basilar artery. Okay, now the branches. So the vertebral artery in the neck, it gives spinal branch which are arising from the second part of the vertebral artery, which enters the vertebral canal and through intervertebral foramina to supply the upper 5 or 6 cervical segment of spinal cord. If you read spinal cord blood supply, so there will be spinal branches and they will be coming from the vertebral artery in the upper 5 or 6 cervical segment. Then there are muscular branches. They arise from the first and third part of the vertebral artery. First part is here, as I mentioned, it is present in the splenovertebral triangle, and third part is which is present in the suboccipital triangle. Okay, so they supply the deep muscle of the neck, and the third part also supply muscles of the suboccipital triangle. Then in the cranial cavity, the fourth part gives meningeal branches, posterior spinal artery, anterior spinal artery, pica, that is posterior inferior cerebellar artery, and some branches to medulla, those are known as medullary branches. Now internal thoracic artery, I know that already it has been taken, internal thoracic or internal mammary artery. I am not going to talk about it. Here you can see it is coming from the inferior aspect of first part of subclavian artery. It is passing downward medially in front of cupula of cervical pleura and entering the thorax behind the sternoclavicular joint, and then it is running about 1.5 centimeter, you can see here, from the sternum, from the lateral border of sternum up to 6 intercostal space where it is dividing into the terminal branches. Remember the terminal branches, musculophrenic and superior epigastric artery. Then there is thyrocervical trunk. Thyrocervical trunk, you can see here, this is the thyrocervical trunk. So it is arising from the upper aspect of the So here you can see the thyrocervical trunk. So here it is. The thyrocervical trunk has origin from the upper aspect of the first part at the medial margin of scalenus anterior. Here, okay, this is scalenus anterior. What are the branches? So there is inferior thyroid artery. Okay, inferior thyroid artery. Then there is superficial cervical artery. Okay, superficial cervical artery. Then there is suprascapular artery. You can see here suprascapular artery. There is transverse cervical artery. Okay, and from the inferior thyroid artery there comes the ascending cervical artery. Okay, these are the branches from thyrocervical trunk. So you can say either the superficial cervical artery or transverse cervical artery, then suprascapular artery and inferior thyroid artery. All these are three branches from the thyrocervical trunk. Okay. Then the inferior thyroid artery. So this is the branch of the, as you know, this is the branch of the thyrocervical trunk which is ascending along the medial border of scalenus anterior just below the transverse process of C7 vertebra. Okay. And what are the branches from the inferior thyroid artery? There is ascending cervical artery, inferior laryngeal artery, and then there are tracheal, pharyngeal and esophageal branches. Okay. There is transverse cervical artery. Okay. That is here there can be superficial branches and deep branches. Okay. There is this a deep branch which passes deep to the levator scapulae and take part in the scapular anastomosis. Then there is suprascapular artery. Can you see here the suprascapular artery? You can see here the superior transverse ligament. The artery passes above the ligament and the nerve passes beneath the ligament. Okay, so suprascapular artery is there. That is also branch of inferior. That is also branch of thyrocervical trunk. Now there is costocervical trunk. As I told you, on right side costocervical trunk comes from the second part, and in left side it comes from first part. So first part of subclavian artery on left side has 4 branches but no any branch from the second part. But on right side subclavian artery has 3 branches from the first part and the costocervical trunk from the second part. You can remember the branches. So deep cervical artery is the branch from costocervical trunk, and superior or highest intercostal artery is also branch from costocervical trunk. Then there is a dorsal scapular artery. It arises from the third part of the subclavian artery, but sometime it may arise from the deep branch of transverse cervical artery. As I told you, transverse cervical artery is branch from the thyrocervical trunk. Okay. So dorsal scapular artery also forms anastomosis around the scapula. Okay. Then what is the applied anatomy? There is something known as subclavian steel syndrome. We have already seen what is subclavian steel syndrome. You can see here, so the blood supply from the right subclavian artery and then from the vertebral artery, instead of going to the basilar artery, it is going to the opposite side vertebral artery, and then it is going to the opposite side subclavian artery because there is thrombus in the opposite side subclavian artery. So the blood is stolen from the brain. So that is known as subclavian steel syndrome. Then there is cervical rib. Okay, what is cervical rib? Here you can see there is this additional rib which is arising from the 7th cervical vertebra. It may compress the subclavian artery. because at that time this subclavian artery is passing between the gap between the scalenus medius and scalenus anterior, so that is known as cervical rib, which will be compressing here. Okay, then there is something known as a dysphagia lusoria. Here right subclavian artery sometime arise from the descending thoracic aorta. Okay, so subclavian artery is not arising from here. For the on the right side, it is arising on the left side. Right subclavian artery is arising on the left side from the descending thoracic aorta, and it will go behind the esophagus. So it will compress the esophagus, leading to difficulty in swallowing, that is known as dysphagia lusoria. Then there can be aneurysm in the subclavian artery. Subclavian vein, there is the same name are there is nothing much to tell. There is something known as subclavian vein catheterization. So subclavian vein catheterization can be approached through either infraclavicular approach or supraclavicular approach. Okay, so by this catheterization via the, here you can see, if you are entering the subclavian vein, then from the subclavian vein into internal jugular vein, there is you will be reaching to the brachiocephalic vein and two side brachiocephalic vein and joining and reaching to the superior vena cava, and you will be reaching to the heart. Okay, there is subclavian vein thrombosis. Then there is internal jugular vein. You can see here internal jugular vein is the largest vein in the neck. It is a direct continuation of sigmoid sinus at the base of the skull below jugular foramina. Right internal jugular vein is usually larger than the left because it drains blood from larger superior sagittal sinus, and left internal jugular vein drains blood only from the smaller inferior sagittal sinus. You would have seen in the dural venous sinus class. Okay, so it descending vertically downwards to end behind the external end of the clavicle by joining subclavian vein to form the brachiocephalic vein. It drains most of the brain and most of the tissue of the head and neck. Okay, what is a special feature of internal jugular vein? First, at its commencement, which lies in the jugular fossa of the temporal bone, it is known as superior bulb, and it is related to the floor of the middle ear. Remember the jugular wall or the floor of the middle ear. Second, close to its termination here, which lies in the lesser supraclavicular fossa between the external and clavicular head of the sternocleidomastoid. Here it is known as inferior bulb, and it is guided by a pair of valve. Okay, you can see here valve will be there, so that the blood will be coming from above downwards, it will not be returning back. Vertically applied to the lateral side of internal and common carotid arteries, enclosed within them. Here within the carotid sheath, internal jugular vein is along with the common carotid and internal carotid artery and the last four cranial nerve. And deep cervical lymph nodes also lie along its course. Remember the upper deep cervical, jugulodigastric, and lower deep cervical, jugulo-homoid nodes. What are the tributaries of internal jugular vein? Remember the first tributary is inferior petrosal vein, which connect the internal jugular vein with the cavernous sinus. There are pharyngeal veins which are coming from the pharyngeal plexus. There is common facial vein. There is lingual vein, superior thyroid vein, middle thyroid vein. Sometimes there can be occipital vein. Sometime, and apart from that, right lymphatic duct on the right side and thoracic duct on the left side. Okay, they also open into internal jugular vein or the junction between the internal jugular vein and subclavian vein. Okay, in upper part of the neck, internal jugular vein may communicate with external jugular vein by oblique jugular vein across the anterior border of sternocleidomastoid. Okay, so there is, all these are the different veins. Then there is cervical part of sympathetic chain. So first there are, what is the introduction? So there are two sympathetic trunk, right and left, in the human body. Each sympathetic trunk is paravertebral in position, and each sympathetic trunk extends from the base of skull to first coccygeal vertebra. Okay, so you can see from here, that is base of the skull, till here first coccygeal vertebra, the sympathetic trunk will be extending, and at the base of the coccyx both sympathetic trunks are joining to form ganglion impar. You would have seen in the dissection of the pelvis. Okay. Now sympathetic trunk in the neck. So you can see here sympathetic trunk in the neck. The cervical part of sympathetic trunk lies in front of the transverse process of the cervical vertebra and the neck of the first rib. Okay, that is the location. You can see here transverse process of the cervical vertebra, all the 6 cervical vertebra. Okay, all the 7 cervical vertebra and the neck of the first rib. Okay, in front of that the sympathetic, cervical sympathetic chain is there. Each sympathetic trunk present 3 ganglia in the cervical part. So when you are talking about the cervical sympathetic chain, here they are 3 ganglia. There is superior cervical ganglion, middle cervical ganglion and inferior cervical ganglion. Okay, not like what you have seen in the thoracic and lumbar sympathetic chain, where there are different ganglia corresponding to each vertebral level. Here they are fusing together to form only 3 ganglia: superior, middle and inferior cervical ganglion. Now sympathetic trunk in neck, sometime inferior cervical and first thoracic sympathetic ganglion are fused together to form the cervicothoracic or stellate ganglion. As I told you, above here is middle cervical ganglion and still higher up is superior cervical ganglion. So here is inferior cervical ganglion. It is fusing with the first thoracic ganglion. So combinedly it is known as stellate ganglion or cervicothoracic ganglion. Okay. Now here initially the number of cervical sympathetic ganglia corresponding with the number of spinal nerves. Okay. So how many spinal nerves are there? So C1, C2, 3, C3. So corresponding to all the cervical spinal nerve. Okay, there are 8 spinal nerves are there. So corresponding to that there were 8 cervical ganglia. Okay. But later the upper 4 cervical ganglia form the superior cervical ganglion, then 5th and 6th form the middle cervical ganglion, 7th and 8th form the inferior cervical ganglion. Okay. Now the cervical part of sympathetic trunk, here it does not receive preganglionic fibers through white rami communicants from the cervical segments of the spinal cord. So each cervical sympathetic trunk gives postganglionic fibers via the gray rami communicants to each of the 8 cervical spinal nerves. Now remember that the diagram of typical spinal nerves, there were white rami communicantes and there was gray rami communicantes. Okay, so white rami communicantes was giving the preganglionic fibers to the sympathetic ganglion, and from the sympathetic ganglion after the relay the postganglionic fibers will be going via the gray rami communicantes. That is what the diagram of typical spinal nerve shows. But here is the exception. In case of cervical part of the sympathetic chain, the preganglionic fibers does not pass through the white rami communicantes. I will explain how. So here you can see here that in case of the typical spinal nerve, you can see here the preganglionic fibers, first they will pass through the, here the white rami communicantes, and postganglionic will go through the gray rami communicantes. Okay, but for cervical sympathetic chain they are not coming here through the white rami communicantes. Okay, so all preganglionic fibers of the cervical sympathetic trunk are derived from the lateral horn cells of T1 to T5 segments of the spinal cord. These preganglionic fibers will ascend through the trunk and finally relay in the 3 cervical sympathetic ganglia. Okay, here you can see that I have shown you in the diagram of a typical spinal nerve. Here what happens when we talk about, I am not talking about the cervical sympathetic chain, I am talking about the typical spinal nerve, where corresponding to the spinal cord here. For example, in thoracic segment, what happens? There will be preganglionic sympathetic fiber, they will be relaying at the sympathetic ganglion, and then via the here gray rami communicantis, they will be going via the spinal nerve, the postganglionic sympathetic fibers, and sometime from the ganglion itself, they will directly go to the particular receptor organ. But in case of the cervical part of sympathetic chain, here the ganglion are not getting the wide rami, ganglion are not getting the preganglionic sympathetic fibers from the wide rami communicantis of the corresponding same spinal nerve, but they are getting the preganglionic fibers from below. Okay, so here it is coming from below and it is relaying, it is coming from below, from where? T1 to T5 segments, and they will not be relaying here because they already are postganglionic fibers, and they will reach here to the superior, middle and inferior cervical ganglion, and then they will pass through the gray rami communicantis, and then here they will pass via the spinal nerves. Okay, so you can see here, this is the diagram, you can see this is the thoracic segment. From here you can see their fibers are coming, preganglionic fibers, they are reaching here to the T1 to T5 sympathetic ganglion, they are relaying here, from here they are going upwards to the cervical sympathetic chain, and they are, without relaying here, they are going to the, via the gray rami communicantis, they are going to the receptor organ. Okay, so cervical sympathetic chain does not have preganglionic fibers passing through the white rami communicantis, because the postganglionic fibers are coming from the T1 to T5 spinal segments. Okay, now individual cervical ganglion, so you can see the superior cervical ganglion, as I told you, it is because of fusion of the first four cervical ganglion C1 to C4, so it is the largest of the cervical sympathetic ganglia. Its shape is fusiform or spindle shape, length is 2.5 centimeter. Where it is located? It is located in front of the transverse process of C2 and C3 vertebra. What it is receiving? It is receiving the preganglionic fiber mostly from the upper three cervical segment. So it is receiving from the thoracic segment. Okay. Then there is branches. So branches from the superior cervical ganglia, you can divide into lateral branch, medial branch, anterior branch and ascending branch. All these branches convey the postganglionic fibers and some sensory fiber from the target organ. Remember again, lateral branch, medial branch, anterior branch and ascending branch. So lateral branch of superior cervical ganglion, they are the gray rami communicantis, okay, to the upper four cervical nerves. Okay, then there are the medial branch. Medial branch means they are going medially. So there is a laryngopharyngeal branch, they go to the supply carotid body and form the pharyngeal plexus along with the 9th and 10th cranial nerve. Okay, then there are cardiac branch. So these are the medial branch of the superior cervical ganglion. The right cardiac branch joins with the deep cardiac plexus and left cardiac branch joins with the superficial cardiac plexus. Okay, then see the anterior branch. Anterior branch of the superior cervical ganglion will ramify around common carotid artery, external carotid artery and its branches. You would have seen all those parasympathetic ganglion. So the sympathetic plexus around the facial artery gives the filament to submandibular ganglion, sympathetic plexus around middle meningeal artery gives filament to OT ganglion, and another filament to genetic ganglion or facial nerve as the external petrosal nerve. Okay, and ascending branch of superior cervical ganglion, that is here known as internal carotid nerve, and branches of the sympathetic plexus around the internal carotid artery It can be caroticotympanic nerve, deep petrosal nerve, nervus conori which supply the pineal gland, or there can be communicating branch to trigeminal ganglion, third, fourth, fifth and sixth cranial nerve, and terminal branches which supply pyometer and tarsal muscle. All these are ascending branches. So I have told you what are the branches from superior cervical ganglion. You can see here lateral branches, there are medial branches, there are anterior branches, and remember anterior branches are the one which are winding around the arteries which are going into the particular parasympathetic ganglion, and these are the ascending branches which are winding around the internal carotid artery and going into the cranial cavity, or will be giving some branches in the carotid canal. Then the middle cervical ganglion. As you know, middle cervical ganglion formed by fusion of fifth and sixth cervical sympathetic ganglia, and where it is located in front of transverse process of sixth cervical vertebra, just above the loop of inferior thyroid artery. So you can see here, this is the middle cervical ganglion, this is the inferior thyroid artery, so here is the loop. Okay, what was the location of superior cervical ganglion? It was in front of second and third cervical vertebra. Okay, communication, so it is connected with the inferior cervical ganglion by ansa subclavia. So you can see here the middle cervical ganglion, and it is communicating with the inferior cervical ganglion by ansa subclavia. Okay, ansa subclavia loops in front and below the first part of subclavian artery. You can see here also the ansa subclavia. What are the branches of middle cervical ganglion? So here are the lateral branches, the same as superior cervical ganglion. So here they will be giving the gray rami communicantes to the fifth and sixth spinal nerve. Then there are medial branches which will be going to thyroid, and there are cardiac branches. Okay, so these are the branches from the middle cervical, and here you can see superior cervical ganglion, middle cervical ganglion and inferior cervical ganglion. You can see the ansa subclavia. Okay, then inferior cervical ganglion, it is formed by the seventh and eighth cervical ganglia. Where it is present? It is present between the transverse process of C7 and neck of first rib. This ganglion joins with the first thoracic sympathetic ganglion to form cervicothoracic or stellate ganglion. I have already told you. Okay, so you can see the superior cervical ganglion, middle cervical ganglion and inferior cervical ganglion. And you can see here the inferior cervical ganglion fusing with the first thoracic sympathetic ganglion, that is known as stellate ganglion. You can see ansa subclavia. What are the branches? So there are cardiac branches, there are lateral branches, gray rami communicantes to C7 and C8. There are vascular branches which form plexus around subclavian artery, first part of axillary artery and vertebral artery. So here is the summary of branches. Remember, superior cervical ganglion, there were lateral branches, there were medial branches, there were ascending branches and anterior branches. So you can see here the superior ganglion, lateral branch, gray rami communicantes, medial branch, laryngopharyngeal branch and cardiac branch. Anterior are going into the parasympathetic ganglion. Which ganglion? OT ganglion, submandibular ganglion, geneticular ganglion. Ascending are caroticotympanic nerve, deep petrosal nerve, nervus conori, communicating branch to trigeminal ganglion, third, fourth, sixth and fifth cranial nerve, and terminal branches. Okay, middle cervical ganglion, sympathetic ganglion, lateral branch, again gray rami communicantes to fifth and sixth, and thyroid and cardiac branch. Inferior cervical ganglion, cardiac branches, again lateral branches, gray rami communicantes, and vascular branches which are forming plexus around subclavian artery, first part of axillary artery and vertebral artery. Okay, so what is the applied anatomy? Horner syndrome. So a lesion which affect the preganglionic fibers from T1 and T2 segment of spinal cord. So what will be the feature? There will be meiosis, ptosis, inophthalmos, anhydrosis and loss of ciliospinal reflex. What is meiosis? You can see here constriction of pupil will be there, drooping of upper eyelid will be there, there will be inophthalmos, that is sunken eyes, there will be absence of sweating on the affected half of face and head, and there will be loss of ciliospinal reflex. Okay, so that is about cervical sympathetic ganglion. So that is topic. Thank you.